Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures to continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 108,486 confirmed cases of COVID-19 in Canada and 36,950 cases in Ontario. Chatham-Kent has 168 cases, and Sarnia-Lambton has reported 287 cases. Michigan now has 70,306 cases, with 11,995 cases being in Detroit. Today, we are reporting 1,840 cases of COVID-19 in our community, an increase of 11 cases from yesterday. 4 are workers in the agri-farm sector, and 7 are in the community. 1,230 cases have now resolved. 517 people are self-isolating. 26% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male, and 34% are female, with 1% unknown at this time. Our community has lost 69 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 2 long-term care and retirement homes in COVID outbreak. In addition, there are 5 workplaces in the agriculture sector and 1 workplace in the manufacturing sector that is experiencing a COVID-19 outbreak. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has two COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to www.wechu.org and click on View Your Results to access the online test result portal. If you are unable to review your results, please contact the assessment center or provider that initiated your test for your results. The health unit will call anyone who has a positive test result. Yesterday, we promoted the Cohesion study. There seems to be a technical issue in accessing the study, but we are working with the investigator to get this resolved. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates.
Good morning, and thank you for joining us again. It is with great regret that we report our 69th death in our community. A woman in her 70s, positive for COVID-19, passed away in the hospital. I would like to express my condolences to family and on behalf of our team and the entire staff at Wichu. Mass questions have continued to contribute to the highest volume of calls, emails, and messages to our health unit. Today, I would like to clarify guidance related to face shields. Face shields are not a substitute for a mask. Face masks, if worn properly, cover the entire mouth and nose, capturing and containing respiratory droplets that come out of an individual's mouth when speaking or coughing. A face shield is a piece of personal protective equipment meant to protect the face and eyes from splashes of liquid. A face shield offers some protection, but it is not a substitute for a face mask. A shield does not hold and contain the respiratory droplets of the person wearing it, nor does it completely protect the wearer. Over the past 4 months, the Windsor-Essex County Health Unit has focused on emergency services only as we redeployed all available staff to the COVID-19 response effort. Starting this week, the Windsor-Essex County Health Unit is welcoming back oral health staff, starting with our Windsor Clinic. From March to July, the WICHU canceled more than 1,500 appointments and have worked diligently to reschedule them to bring them back for urgent medical care. We are pleased to restart appointments with our dentist and preventative services with our registered hygienist to complement the services currently provided by our dentist. As per Ministry of Health requirements for health sector restart and guidance from the Royal College of Dental Surgeons, visitors to the dental clinic will be limited to support persons and the patients only, and will be required to come wearing a face mask. We know the cancellation of appointments and stoppage of services for 4 months has had a significant impact on the vulnerable seniors and children we serve at the Windsor-Essex County Health Unit, especially those with Healthy Smiles Ontario or Ontario Seniors Dental Program cards close to expiry. The Windsor-Essex County Health Unit was pleased to receive notification from the Ministry of Health that all individuals currently enrolled in Healthy Smiles Ontario or HSO program or the Ontario Seniors Dental Care Program or OSDCP would automatically be renewed for next benefit year, easing some of the stress and burden of this experience. For information about the HSO, the OSDCP, or services offered through Windsor-Essex County Health Unit Dental Program, residents can call 519-258-2146 extension 1199. Our Windsor Clinic is open Monday to Friday from 8:30 a.m. to 8 p.m. by appointment only. Thank you.
We'll now take questions from the media.
The conference is now unmuted.
We'll now take questions from the media. Is there any
questions from Windsorite?
The additional death today, was that connected in any way to the agri-farm sector?
No, this was a community person, a female in her 70s. She died after getting complications from COVID and was admitted in the hospital.
Okay, thank you.
Any questions from Windsor Star?
Yes, good morning, Doctor. We know from previous reports that our region have pretty bad teeth. So do you think the 4 months without treatment for individuals that the health unit serves will make a big impact on their smiles?
Well, I think that's the challenge that we have struggled, and we wanted to bring it back to offer the service back to our community as soon as possible. Emergency dental care was being provided at all time, but now we are expanding it to ensure that all the other type of preventative services are coming back for these clients. Hoping that this would bring more people and the people the appointment that were previously rescheduled, we'll try to bring them back quickly to get some of that work done, and hoping that this would help them with everything that they need.
And just for clarification, you said that 1,500 appointments were canceled. Has the health unit been able to reschedule all of those appointments?
That is correct. Yes, we were able to reschedule all of them.
Thank you very much.
Any questions from CTV?
Yes, good morning. So bringing that staff back means that you'll be thinner in your staffing levels again. So I know you guys are going into your board meeting tomorrow. So is it your hope that you can add staff right away?
Well, that's the hope and that's the plan, and we've had this ongoing challenge in redirecting our resources to COVID, and we are recognizing that there are other important areas of public health that need support. COVID is here to stay, and with the support of our board, we are hoping that we can dedicate some staff to do the extra work related to COVID, in addition to the existing infectious disease program and the health inspectors that are currently supporting it. We can get some additional support, and then we can also try and focus on some of the other public health programs that we were deferring as a result of COVID.
So I guess the $1 million question is, who's going to pay for that? I mean, obviously budgets are tight. Will you guys reach out to the province and say, hey, help us out?
Well, we are reaching out to everyone, including the province and also to our board. Obviously, this is unprecedented times, and everyone realized that the work of public health has increased significantly. And there could be some provincial support, there could be some local support. So we're hoping that our board can help us secure some funding either through locally or through their advocacy efforts with the province. We've been also in communication with the province as well, identifying the needs of our health unit.
Okay, great. Thank you.
Any questions from CBC?
Yes, good morning. I spoke with a woman yesterday who had her COVID-19 test results were lost, and the health unit was helping her track those down. I'm just wondering, has there been many lost test results reported?
There has been few, I would say, so health unit, obviously we're not doing all these community-based testing, and most of these testings are happening at the assessment center, and then the result is posted online on the website, and most individuals are encouraged to access those results online. Sometimes their doctors give them a call and notify them about their results. The public health unit always call the positives. So everyone, if you're positive, you will get a call from the health unit. But if you're negative, you will have to go and check your results online, or connect with your healthcare provider where you got your testing done to confirm your negative results. There has been some instances, I wouldn't say a lot, and we tried our best to help them. Sometimes I personally called the lab to track those results down, but our team is working really hard to track those results through the online portal, or working with the healthcare provider to notify the results.
Thank you.
Any questions from Blackburn?
Yes, I know we've touched on this before, but I'm just looking for clarification. Are there any restrictions in place for the farms to take on casual workers, just like day-to-day workers, like anybody from the community or temporary foreign workers?
So there are some provisions in the order that prohibits them from maybe getting a worker for a day. They can get a worker for an extended period of time. The farms that are currently in outbreak, they have a specific recommendation that they cannot hire anyone through temporary agency. That's where the concern is, because some of these temporary agencies are recruit people and then just move them from one farm to another. Some of them could be undocumented workers and can potentially be infected, and then moving them from one farm to another increases the risk for spread of COVID-19 in multiple farms. So the recommendations for anyone who is employing these local workers who are in the community, that they have to be recruited directly by the farm owner operator, and they have to follow certain restrictions in terms of how they should work. The general idea is they shouldn't be coming in contact with any of the existing worker. They should be working separately, cohorted separately, and has to follow all the screening measures, screening protocols. And their work, they shouldn't be working, or they shouldn't have worked in a farm with an active outbreak at least in the last 15 to 30 days. So that's the general guidance, but we work with the farm owners to provide them more specific direction. So some of those are in place, and we definitely don't want people to work in one farm one day and another farm another day.
But it's just the farms that are currently in outbreak that are restricted from using the temp agency?
Well, under the order, there are some restrictions even for the other farms that are not in outbreak, that they have to hire these individuals for a longer period of time, rather than just for a day off work.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, I'm not sure if you can get into this, but you mentioned complications for the woman that passed away. Can you say when she first was a confirmed case, and then the complications occur like a couple months later, a couple weeks later? Can you share any details on that?
I would say everything happened within a month timeline, yeah. So it's not, we're not talking about months and months. I think it's happened within a month.
So if I have it right, she was confirmed case, she went home, and then she had complications. She was rushed to hospital or sent to hospital, and she passed away in hospital?
She stayed in the hospital as well to receive some care related to her medical conditions, and then she passed away.
Thank you.
Okay, thank you, everyone.
Thank you.
Thank you.